Hello everyone, I'm Dr. Aparna, consultant neonatologist and pediatrician at KIMS Cuddles, Kondapur, Hyderabad. This is the beginning of monsoon time, and this is characterized by a resurgence of infections in children. Now let us discuss some common steps that we can take as parents to prevent infections and morbidity in children in this season. Some important infectious illnesses we see are the mosquito-borne diseases, that is diseases spread by vectors like mosquito. Common examples are dengue, malaria and filariasis. And the other group of infections are waterborne infections. Both these are common during monsoon season. Waterborne infections include typhoid fever, hepatitis A, rarer viral gastroenteritis, cholera, which has become relatively less common now, etc. So what are the common precautions we should take to prevent these kind of infections? Let's first take up the mosquito-borne illnesses. So the first common precaution is to prevent breeding places for the mosquito. Now the common viral dengue that we see often during the season is spread by the Aedes mosquito, which tends to breed in clean water. So prevent accumulation of clean water around your houses and around the kids' schools. So take every precaution to remove open cans, open buckets or large shallow areas where rainwater can collect around your house and around your children's schools. This important step eliminates the breeding ground for mosquitoes, which are the important vectors for spreading infections like dengue. The next important step is to, of course, avoid taking children out wherever possible, wherever it is avoidable. Try to avoid taking them to crowded places where mosquito infestation is very common, like say gardens where you might find a lot of mosquitoes. Wherever possible, try to avoid taking them out there. And whenever it is unavoidable, try to always dress up children in full hand pants and full sleeve shirts so that the area exposed for mosquito bites is kept to the least possible. Now often parents ask us whether we can use mosquito repellents. You may use mosquito repellents judiciously, but making sure that the area is washed off with soap once the child is back home. So when you're taking them out, you may apply the repellent, but after bringing them back, make sure it is clean completely, or you give them a bath so that they don't lick or they don't consume the mosquito repellent cream accidentally. Likewise, when it comes to the waterborne diseases like enteric fever or like hepatitis A, which are spread through contaminated water, one must take every precaution to ensure the cleanliness of drinking water. So boil water, rolling boil for at least 5 to 10 minutes and then cool it down to room temperature or cool it down to acceptable temperature before giving it to children. This eliminates most of the infections that can be spread through water. And before giving water to kids, ensure that you have washed your hands and also ensure that children who drink water on their own have washed, sanitized their hands before consumption of food as well as drinks. By taking these common precautions, we can ensure that our children don't get exposed to the common illnesses that we see during monsoon season. Thank you.